Thank you. Hi, everyone. I'm back. So I'm going to go through the questions and answers. The way I'll have it set up, you'll be able to see the question on the slide along with the amount of likes it received or the upvotes it received, and then I'll read the response out to you. So the first question is on oral hygiene. If a patient does not have teeth or dentures, how do you code it? 9 NA, or do brushing gums count? So if a patient is edentulous, that's without teeth, code oral hygiene based upon the amount of assistance the patient needs to complete the activity. In this scenario, you would code based on the amount of assistance needed to brush the patient's gums. Assess the patient for use of the appropriate oral hygiene tools for performing this activity and code according to the assistance the patient requires. Next, we have if a patient is able to walk with one helper but needs a second helper to push an IV pole or an oxygen tank, is that scored as an O1? And the answer to this question is when coding GG0170I, walk 10 feet, code based on the type and amount of assistance provided by the helper. In the scenario you provide, if the helper only manages the oxygen tank or the IV pole, code GG0170I, walk 10 feet as O4, supervision, touching assistance, because the helper is required to be present during the activity in order for the patient to complete the activity safely. Next question. For curb one step, how would you recommend coding on the IRF-PAI if patient is unable to do a curb step but is able to do a step with a handrail? So the answer to that is if the patient is unable to step up a curb with or without a device but can go up and down one step with a railing, again with or without a device, code the one step item based on the step with the railing. Next, we have what if a patient has a C-collar but it is never taken off during their length of stay? Does their ability to don or doff need to be considered in the score? Patient must wear it all times. So when assessing GG0130F upper body dressing, the C-collar would be considered a piece of clothing if it is related to tasks associated with dressing or undressing. Use your clinical judgment to determine the type and amount of assistance the patient needs when assessing dressing and undressing. The next question, there are several errors. This is more of like feedback and a question. So there are several errors in the training manual, i.e. reference to section 6. Will this be corrected in future manuals? And we thank you for your feedback. CMS will address this in a future version of the IRF-PAI manual. The next question, for the toilet transfer, if the patient didn't use raised seat prior to the surgery but needs for precautions, wouldn't it be in 88 if we were scoring on prior level of function? So for the admission assessment, the patient may be assessed based on the first use of an assistive device that the patient has not previously used. The clinician would provide assistance as needed in order for the patient to complete the activity safely and code based on the type and amount of assistance provided. You would only code an activity not attempted code if the activity did not occur during the entire 3-day assessment period. So the next question is, there are updated versions and copyright dates on some of the spades. Because of this, we are unable to adopt the CMS version in our company's EMR. Is CMS able to update their version of spades to match the most recent versions? Our answer is copyrighted items finalized in the fiscal year 2020 IRF-PPS final rule for use as spades were used in field testing and have been aligned across the various post-acute care settings. CMS requires that IRF providers use the version approved in the version's fiscal year 2020 IRF-PPS final rule. Next question, prior training has stated that the shower, bathe, self activity can occur at a sink. Can a bed bath be coded for low-level patients, or should codes 09 or 88 be used as appropriate? So when coding GG0130E, shower, bathe, self, code based on the type and amount of assistance the patient requires to complete the activity. That's washing, rinsing, and drying, regardless of where the bathing takes place. Per guidance in the IRF-PAI manual, GG0130E, shower, bathe, self, does not include transferring in and out of a tub or shower. Next question. For GG sections, if the patient participates in 10% of an activity, does that code to 1 dependent or 2 max assist? When scoring Section GG data elements, score based on the type and amount of assistance provided. A decision tree is available on the CMS IRF-QRP website that Karen just talked about with us to help guide clinicians through the questions they should answer when determining how to code Section GG activities. There's also a decision tree in the IRF-PAI manual, currently on page GG9. Next question, for scoring eating, what if the patient is on a modified diet? Is this scored as 06 or 05 setup? The intent of GG 0130A is to assess the patient's ability to use suitable utensils to bring food and or liquid to the mouth and swallow food and or liquid once the meal is placed before the patient. In the scenario you describe, if the meal is placed before the patient with a modified consistency diet, and the patient can bring the food to his or her mouth using suitable utensils and swallows the food and or liquid safely, code GG 0130A as 06 independent. Okay, we have some DRR questions now. Is admission assessment for DRR should also be done within the 3 days of admission or on day 1? IRFs would follow best practices by conducting the drug regimen review as soon after the patient's admission as possible. DRR items N2001 and N2003 would be completed upon admission or as close to the actual time of admission as possible. Any clinically significant medication issues identified during the drug regimen review or at any other time throughout the patient's stay must be addressed by midnight of the next calendar day. While item N2001 and N2003 apply only to the drug regimen review conducted upon admission and to potential or actual clinically significant medication issues identified during the admission drug regimen review, N2005, medication intervention, which is completed at discharge, identifies if every clinically significant medication issue identified throughout the patient's stay, and that's admission through discharge, was communicated to the physician or physician designee, and to the extent possible, prescribed recommended actions were completed by midnight of the next calendar day, each time potential clinically significant medication issues were identified since the admission. I think we did this question already, but for bathing, can this be in bed? Only noted as shower, bath, or sink. So I talked to you guys about this one. I'm just going to skip to the next one. For upper body dressing, hospital gown is considered as score 10. So the intent for this item is to assess patient clothing that will be worn in the community. If clothing is available by day 3, code based on the assessment conducted on that day. If clothing is not available by day 3, paper scrubs could be used to assess the activities of upper and lower body dressing if no other clothing is available. And if a patient does not have upper body clothing other than a hospital gown during the entire 3-day assessment period, then yes, you would code 10 not attempted due to environmental limitations for GG 0130F upper body dressing. Okay, the next question was, how do I access materials in the event hub? So the event materials for today's presentation can be located in the download section of the IRF-QRP training webpage. And I know Karen talked to you guys about that earlier, so I encourage you to set up that time. Definitely go ahead and go on that website. The event hub is pac.training/IRF/August 2019. The next question, what is the process for submitting quality data for the quality reporting program? So data for the IRF-QRP measures are collected and submitted through 3 methods: Inpatient Rehab Facility Assessment Instrument, or the IRF-PAI, Centers for Disease Control and Prevention, or the CDC, National Healthcare Safety Network, and that's the NHSN, or Medicare fee-for-service claims. IRFs must submit data no later than 11:59 p.m. Pacific Standard Time, the day of the submission deadline. The IRF-PAI must be transmitted to CMS using the Assessment Submission and Processing System to the Quality Improvement Evaluation System. Data for the National Healthcare Safety Network measures must be submitted to the Centers for Disease Control. No additional data submission is required for the claims-based measure. CMS strongly encourages submitting the quality data prior to the deadline, ensuring the data is complete and accurate, and to address any data submission issues. For more information about IRF-PAI submission, you should check out the IRF-QRP website, or you can also email help@qtso, that's QTSO.com. For more information about how to verify your data submission, please see the IRF-QRP site. And for questions about IRF quality data submitted to CMS via CDC's NHSN or NHSN registration, email nhsn@cdc.gov. And I am going to turn it over to Bridget now, who will guide you all on what's coming next. Thank you so much.